This is going to be a quick journey with me into a topic that I'm spending a lot of time on. I'm a health economist by training, and when I started in this almost 30 years ago as a young graduate student coming out of the health economics department at University of Michigan, any Wolverines or Big Ten? Go Blue, thank you. I learned all about health care in hospitals and doctors' offices and health plans. And then I fell in love with my husband and I moved to London and got to work in the National Health Service in a single payer system and cut my teeth on technology. And subsequently learned about the role of self-care for moving the cost curve for patients, and that's my passion right now, is this expanding world of retail health. So when Shai Gozani, who you're about to meet, Dr. Shai, he's right there, Dr. because he's MD, PhD. When Shai and Patrick and I got on our call for the next session, Shai said, retail health has a lot of meanings, what do you mean? So we're gonna run through what I mean by retail health and what we mean in this big kumbaya kind of sense under a big umbrella. So more about me. Last year I became an Italian citizen, now carry an EU passport. And this is my favorite pharmacy in the world. It's in Florence, Italy. Maybe you've seen it. It's affiliated with the Church of Santa Maria Novella. And it is one of the first pharmacies in the whole world. Retail health traditionally has been thought of as the pharmacy, but it's way more than that. If you live in New York City and you go to Greenwich Village, you can go to the first licensed apothecary in the United States, C.O. Bigelow Chemists. Some of their products are sold at Target, at Target even, in their beauty and health aisle. That pharmacy still exists today. And now here's another pharmacy, right? Located within 5 miles of most Americans' homes, they tell you. Same with Walgreens. They tell the same story, to be even here. This is a pharmacy, right? Is this a pharmacy? This is this expanding world of retail health. So in Jane's world, my world, which is very expansive when I think about retail health, we look at bricks and mortar things, stuff we can do in our homes, in our hands, all the way through to the virtual health world of Teladoc and American Well and Virtuwell and Zipnosis and the growing telemental health providers and everything in between. I'm particularly interested in the grocery store as a health destination lately. And if you think about your grocery stores where you go, I bet you there's a pharmacy, there might be a clinic, there's healthy food aisles with, of course, gluten-free and everything else for managing your gut health. And increasingly, these folks are also offering telehealth. So as Arshis said, there's this great blurring going on in retail health. Now let me tell you why I earlier said the patient is the consumer, is the payer. About 13, 14 years ago, I was working with one of the biggest pharmas in the world, a global company, and I was their environmental analyst. I was informing their strategy on all the things shaping the business. And I noticed from year to year to year, all of a sudden, and you in the pharma business know this, the tiers for co-payments started to widen, what they call the co-payment spread, from tier 1, the generic, to tier 2, the brand on the formulary, to tier 3, the brand not on the approved list. And if you look at the red space on the bottom, which you can read, you can't read the black, which is the Kaiser Family Foundation employer survey that they do every year, the results, you can see how the spreads have grown. So last year, the average spread between a generic, a tier 1, at about $11 in America, compared to the brand off formulary at $59, that's $50. And in my house, economist married to a banker, we call that real money. So patient, consumer, payer. Now let me tell you what I talked to the pharma about a year ago when I got access to the United Healthcare formulary, which is published online, so I'm not telling tales out of school. 2017, you're right, are 3 aggressively direct-to-consumer promoted drugs for popular conditions of the heart, cardiac care drugs. And all those were tier 3 drugs in 2017, meaning the average patient had to pay the average copay of $59 if they were on United. Now, here's the scenario I presented to the team in the pharma. A chief household officer the wife, went to CVS, Walgreens, Rite Aid, wherever, to fill a prescription for her husband for one of these 3 drugs. And it happened to be her beloved's birthday that week. As a responsible chief household officer, she balances the family budget, and she had to say, the drug prescription or the razor for her husband's birthday. And I have downloaded here a few razors that actually cost about $50 in 2017. She chose the razor because that's what people really do. 35% of people ration their refills of drugs based on cost in America now. This is our world. And this is why we call the patient a consumer now, because in the United States right now, with a median family income of about $60,000 a year, the average family has a $5 bill and will spend one of those dollars on health care costs. That's 20% of the household budget. Again, real money, real people. That might not be your family, but this is the median family in America. So we have this new patient consumer evolving, looking for solutions to manage that $1.05 for healthcare costs, and maybe they can lower the cost if they do things to take care of themselves. 3 other forces to keep in mind as you're walking the show floor and thinking, will people pay hard-earned dollars for this stuff, for their health? 1, the Great Recession really reshaped consumers, not just in America, but in the developed world, who were also hit in 2008 by the recession. What happened after the recession is the rise of HGTV, home cooking, gardening. Lowe's and Home Depot did really well in the recession because people were taking care of their houses themselves. And there was a more DIY, do-it-yourself mentality. Self-care started to increase again, increased spending on over-the-counter drugs. The second thing that happened in the middle, it's hard to read, smartphones started about 10, 11 years ago, and of course, quick adoption of computers in our hands, again, to access information wherever we are. And the third factor, which I speak a lot about and write a lot about lately, is the Amazon priming of the consumer. I want it now, I want price transparency, I want reviews from consumers, and I get it in a day or 2. So we have this evolution of a person. These are patients from Homo sapien to Homo informaticus. We have the power to look for information, to access it. We heard about WebMD mentioned earlier. Don't just have to use WebMD anymore. People obviously use Google as Dr. Google. But here is the bottom line. When we ask Americans, 2 years ago, Aflac, the cute duck company, asked Americans, what do you want your health insurance shopping experience to feel like? Half of Americans said, I want it to feel like Amazon. And 20% said, I want to shop for insurance like I do in the retail world. This, though, is the experience a person has with their doctor when they go for a lab test. I'm sending out the test, and you will never get your result back. That's what it really feels like, particularly if you got tested for something very serious. So healthcare doesn't feel like Amazon Prime, really. We heard from Ashish and David about Best Buy and Great Call's Alliance now. It's wonderful. That's the new retail health. And Patrick and Shai are going to expand the conversation on retail health now. Come on up, guys. We're going to hear about the emergence of over-the-counter hearing aids, which is a new thing, and the emergence of an FDA-cleared medical device for pain, which I can attest actually works. So, and I bought mine with my own 1 in 5 medical dollars. So Shai, I haven't seen you this morning.
Thank you.
Patrick, hello. So, retail health, guys. Here we are. First, we're going to have each gentleman introduce themselves. I love to do that. So Shai, why don't you talk about yourself a little bit?
Okay, briefly, thank you. Well, nice to see you again.
And you.
So my name is Shai Gozani. I'm the CEO of Neurometrics, and Neurometrics is the manufacturer, and we also market the Quell device, which is a wearable neurostimulator for treating chronic pain. It's also a digital health device in that it wraps that neurostimulation technology in a digital health platform to help people manage their chronic pain.
Great. And Patrick?
I'm Patrick Freuler, the founder and CEO of Opioid. We've built an online hearing care platform that lets you test your hearing online and then buy a customized hearing aid for a fraction of the cost, also online. And this really addresses a pretty big problem because hearing loss is something that affects about 40 million Americans, and there is very limited access to hearing aids, and it's also extremely expensive. So the average hearing aid will cost around $2,500 and is very seldom covered by insurance. So Opioid fixes all that.
That's fantastic. That's retail health. People paying out of pocket, looking for cost-effective self-care solutions. So Shai, let's talk about Quell. So Neurometrics is the company that Shai represents, leads, and Quell is the pain device we're talking about. What drove you, and we've had this conversation a few years ago, but they haven't heard this. What drove you to start the company and bring this FDA-cleared device to market?
So we don't have enough time to go back 20 years, so we'll just start with Quell, if you don't mind.
Right, 12.
So we'll just go back about 4 or 5 years.
Yeah.
What really motivated us was what I would describe as a dual epidemics of chronic pain and opioid overuse, and we've had other discussions, I think yesterday about opioids, and I think it's well understood by the community that there's a real problem here. So what's happened is that people with chronic pain, as a result of the opioid crisis, have had their access to prescription opioids severely restricted. Yeah. And it's a separate debate whether that's good or bad, but the fact is that's occurred. As a consequence, they are out there looking for solutions of necessity. At the same time, I think the response of the healthcare system to chronic pain and opioids has been, I would say, incomplete at best, and that's left people with chronic pain really feeling abandoned, and again, understanding that if they're going to solve the problem, and this is the the epitome of retail health, they're going to have to solve it on their own. Mm-hmm. So they're out there looking for solutions, and I think the good news is that with the democratization of health information, there are many sources. They can go online, they can learn about options, they can study them, they can go as deep as they want on WebMD or go to the primary literature if they so choose. But the good news is that they're out there, they're studying it, and they're looking for solutions. So Quell is a technology solution. Yes. It's not a panacea. It's one of the options for people with chronic pain to consider and potentially to try. So we were motivated by that. We have neurostimulation expertise. We saw the opportunity. We found we thought that would be a good direction for the company to go, potentially to help address this problem. That's
great. And clearly the hearing issue is huge. I just read a study a couple weeks ago, peer-reviewed, that showed hearing loss is a risk factor for chronic illness because people feel isolated, don't look for care. So what were the underlying drivers that got you to develop Opioid?
Sure, and to echo that, it's true, hearing loss is closely correlated with dementia and depression and other mental health conditions. Now, we saw a very large problem that was just unaddressed by existing brick and mortar healthcare. And on the other side, we also saw that the customer segments that needed hearing care, the 50 to 70 and plus segments, were becoming increasingly more knowledgeable about technology, right? The average 60-year-old today uses technology in a very different way. They're on social media, they do healthcare research online, they buy stuff online. And as a result, there is just new models for hearing care that we could develop on top of that just would coexist with the expensive brick and mortar models. And so from that standpoint, like the time was ripe for this. At the same time, there's currently a lot of deregulation that's happening in this industry, where in the past, hearing aids could only be accessed through a licensed physician. And over the course of the next year or two, with the Over-the-Counter Hearing Aid Act, this should change. You should be able to access hearing technology in a retail environment. So all of this is a bit of an explosive mix where we felt we could really make a difference in people's lives.
That's fantastic. So both gentlemen have articulated the need for pain relief and hearing support. But we economists differentiate from need to demand. And demand is a person's willingness to pay for something. So Shai, what are some of the barriers you have to overcome? And how do you create a value proposition that's compelling, that encourages people to try?
Sure. Well, I guess we can start with the barriers, and maybe then we can move to the value proposition. I think, in simple terms, and I'll expand on it in a moment, you've got awareness, believability, and attitude. And let me just explain that a little bit more. So I think awareness is the obvious issue that you think you have a great solution. There's 100 million people with chronic pain. How do you let them know? And I think if I went to 100 million, as we've been in this now for a little over 3 years, and we went and talked to 100 people with chronic pain, I think probably a few will say, "Oh, I've heard of Quell," despite the fact that we've been out there and trying to build awareness. So it's very challenging, particularly for smaller companies who don't have established brands. So I think awareness is just fundamentally, a barrier that you have to overcome. They can't get your product or think about your product unless they know about your product. Believability is maybe an issue that is a little bit more unique to Neurometrics than, say, to your company. Historically, pain and snake oil have been I'm not going to say friends, enemies, something like that. If you can go back centuries, and there have been all kinds of concoctions to treat pain, because pain has been around as long as people have been around. And even today, unfortunately, there's just a lot of snake oil out there, and I think consumers are aware of that, as they should be. So when you have what we believe is a legitimate technology, you've got FDA clearance, we've done, you do clinical work, but you still have to overcome that and convince people that yes, this is real and it's not the next, snake oil. So I think that's something that is hard to do sometimes, and it sort of builds on awareness. So if you build the awareness, and then you try to build the believability and credibility. And the last, and I think this is every consumer healthcare company has this problem, is what I would call payment attitude. And you've alluded to a little bit, people don't really expect or believe that they need to pay for healthcare. They're increasingly understanding they have to, but somebody else pays for their healthcare. And obviously in an over-the-counter product, they have to open up their checkbook and pay for it. So you have to really create a value proposition that suggests that they should do that. And we still have many people, we go through awareness, we go through believability, and then we get to payment, and they're like, well, isn't it covered by Medicare or Blue Cross Blue Shield? And we're like, well, no, it's an over-the-counter product, and here's why. And so that could create kind of the third barrier to adoption. Do
you think under a growing value-based payment system where a physician's taking more risk to manage an episode of care where pain is associated, that could be a positive driver toward a physician recommending something like Quell?
I'm optimistic about that. I also live in real time, and so we have to sort of solve the today problem and then work towards the tomorrow solution. So I think I'm optimistic if you look at, for example, what some payers are doing with trackers, where they're offsetting the cost of an Apple Watch or a Fitbit device. I think that might be a model for things like ours, where if we can show the value and the benefits, and so we're thinking about that, but that's not going to happen now. That's going to be something we have to work to over the next several years. Yeah. Okay.
So Patrick, some of the barriers for people with over-the-counter hearing aid, not having that intermediary of the audiologist physician.
Yeah, I mean, a lot of the issues that we face are very similar to what you've just highlighted. I think there's one element that has to do with the stigma of the products that we have, right? Traditionally, hearing aids were products that were for old people, for old people, people with disabilities, right? And on one end, we're a consumer health company that highlights the consumer part of that sentence. So we need to invest a lot in branding and really repositioning that product as an aspirational product that doesn't come with all that dusty past, right? But you need to balance this more aspirational positioning and consumer positioning with the trust factor, right? The rigor that goes into the technology and the process that we've put in place. So the branding piece is very important. I think the other barriers really ultimately have to do with how the consumer still operates online. We still are dealing with a 60-year-old that needs a bit more hand-holding and still requires a person in the loop that do that final checks and balance. So in our experience, the technology doesn't completely obliterate the process.
Yeah.
It works more hand in hand with an expert on the other side.
So how do we overcome the barriers then? I mean, the price is the price, but the value of reducing pain, one would think would be compelling, not to drive somebody to snake oil, but what are some of your strategies?
Yeah, probably actually as I'm listening to Patrick, I'm thinking we should talk more. There's probably a lot of similarities and maybe there's even some leverage. But I think the first thing, most important, is kind of what's our brand promise. What do we, from an aspirational perspective, offer or suggest to the consumer, and that's reclaiming their life.
Yes.
We don't actually talk so much about pain intensity or reducing your pain. We talk about reclaiming your life because what we've learned, and this is well understood, that it's probably similar for hearing loss. The issue is not the underlying pain intensity. If I'm a 7 out of 10 or I'm a 3 out of 10, it's how has that affected my life? How has it affected my sleep, my activity, my social relationships, my work ability, and so forth. So that's what we try to talk about. And I think digital health, or the digital health piece, is really important for that because you're really looking at the person as a whole, not as a physiological pain processing system. Beneath that, what we talk about is getting pain relief without side effects or without significant side effects, and that's the comparative point to some of the alternatives. We talk a lot about digital health. You're sort of buying into a system. We're going to try to help you kind of capture everything around your pain. We're going to look at your sleep. We're going to look at your activity. We're going to look at your mood and try to help you not just by stimulating your nerves, but by trying to improve the way you think about pain. And practically speaking, probably one of the most important ways of overcoming the barriers is we give people a 60-day trial. And that is probably the single most important way to overcome all the barriers in aggregate, which is, look, at the end of the day, you do your own N of 1 clinical trial. You try this. If it doesn't work for you, you return it. Nothing venture, nothing gain. If it works for you, I may have really significantly improved your life. And I think at almost at any price point, but definitely at the price points we're talking about, which are in the hundreds of dollars, you need something like that to overcome that constellation of barriers.
And can you tell us what the return rate is, or is it
Happy to, yeah.
20%?
It's exactly that. So we predicted. So great. So how'd you know that? So coming out of the gate, we expected 20 to 25% return rate based on the clinical data we had because. Analgesic mechanisms don't work for everybody. There was no reason to expect it to be 100% clearly, but we didn't know, it could be anywhere, say, between 50 and 100. We have really remarkably consistent 20 to 25% return rates. Some variance in channel, so in some channels it's higher, some channels it's lower, but that's really been locked in. And so we've essentially had to operationalize that return rate, just something that's part of the business, and you have to work that into your models and your business strategy.
Absolutely. And for you, how do we overcome the stigma? Because hearing loss is supply side of hearables is all over CES. So there's some bullish a feeling on the supply side of it. And you're saying the demand side might not be so bullish. So what are you thinking about overcoming the stigma?
I mean, there's a number of things we are doing and will do to really overcome those initial adoption hurdles. One is really to stress the benefits rather than stress the deficiency. You have more of a rhetoric around how you're going to reclaim your life, right? But I'll give you an example. Right now, we are reshifting our business model around not just buying a hearing aid as a one-off transaction, right? You buy a pair, and then you don't buy another one for another 4 or 5 years.
Sure.
Towards one where we're moving more towards a subscription model, right? Where you can treat a hearing aid almost like a mobile phone, right? Where you sign up to a plan for $30 a month, and you get all the services, all the accessories, all the upgrades, and everything that you're already familiar with a product that you already hold in your hand, right? Your phone.
Right.
And so it will require a multi-pronged approach where you change the business model, you change the pricing, you change the channel, you change the branding. So it all needs to ultimately work together.
Mm-hmm. You know, Patrick, it strikes me, this whole idea of subscription and service is a big theme coming out subtly. I say it's a big theme because I'm hearing it from a lot of tech companies now, which is technology as a service. Or service as a service. But I mean, this issue of supporting people at home and in everyday life. And then the issue of these monthly payments, I quite liked for people to manage budgets also. So, and plus $30 looks a lot better than $300.
Yeah.
You know, it's sort of, you can hide it in the Visa bill. Like cable companies tried, well, cable's way more than that. But in any case, a lot of companies try to do that. But I think for the consumer, in terms of health finances, that's a really attractive idea.
Yeah, to echo your point, we call this almost like hearing as a service.
Yeah.
Right? So.
HES. We have a new app. Oh, I can't say that. But HES, got it. So we have a couple minutes. Can you each give us a minute on sort of the prospects for the future for your product in this growing retail health ecosystem? Because I am bullish on both of these things, and I'm pretty dismal about a lot of financial stuff. So, Shai, what does this look like?
Well, we're very bullish. I mean, we're sort of public company, so I can tell you the numbers. We've sold about 200,000, approaching 200,000 devices over the last several years. That's a drop in the bucket against 100 million people with chronic pain, but we're really starting to connect with people. What we're starting to do more than anything else is starting to leverage the data we have.
Good.
We are collecting. We have 70,000 people who are contributing to our Quell Health Cloud, which is a cloud data collection mechanism, and now we're starting to use data science approaches and starting to optimize the outcomes as a result. So I think we're going to be able to get more people to have better outcomes more quickly, and I think that's going to help us. So we're very bullish, optimistic, and we're looking forward to the next year.
Love it. A data story. Good. That's wonderful. It's great. And
AI too. We always have to say AI.
Oh, AI.
How can you be here and not say AI?
We
of course.
We know that. And Patrick, how about you?
Yeah, we have a really disruptive product, which is our hearing test, our hearing diagnostic, which over the next couple of months will kind of transform it to more of a hearing test kiosk that you could even find inside of a CVS or inside of a Best Buy, or just a location that's not associated with an audiologist, right? And so at some point you have these hearing tests that are quite ubiquitous and just give people a lot more access in the physical world. Now, I do think that as it relates to our company, I think the winning strategy at the end will have to bridge the online physical divide, right? Where on one side we have a solution that's direct to consumer, all online. There's going to be a solution that starts online but then ends in a local environment, right? And then there's solutions that are fully local, right? But enabled by hearing test kiosks or other solutions. So it's going to be multifaceted, but we're super excited because clearly the condition is not going away.
Right.
Hearing loss is something that, especially noise-induced hearing loss, is rampant. There's an aging population segment, and it just calls for more solutions.
Absolutely. And if we think of just about retail is omni-channel, and retail health also has to be omni-channel, where people live, work, play, and learn, as we say. So thank you both, and thank you for our hour of retail health goodness. Thank you.
Thank you.